Okay, so I've been at the clinic for about 3 months, and I started with a number of methodologies to attack a neuropathy that was driving me crazy since 2015 when I had cancer and chemotherapy, which I think caused the neuropathy in my legs and particularly in my feet. I've got some other issues associated with numbness in my hands and face, but we think that's a different phenomenon, probably associated with the cervical spine. Anyway, I did all of the methodologies, including some UV lights on my legs, some electricity through my feet. I did these religiously at home, along with changing my diet. I gave up milk. I gave up my cereal of 40 years. And I really didn't believe any of this would help, but I'm getting to the punchline, and I'll tell you it did help. But when I go to the clinic, I did other things, including this mild shock treatment, which to me was a little upsetting. The balance machines, what I think are very good for maybe rewiring the brain. And some chiropractic work, including a decompression machine, which attempts to separate my head from my torso. But it's the chiropractic work of Dr. Scharf that I think is really making progress overall with me, including my issues with my face and hands and shoulder. The result is that the neuropathy, I've left out maybe one of the most important methods, which is PRP, the platelet injection program, where they take your blood at the time, use a centrifuge to separate out the platelets from the other parts of your blood, and then inject them actually in the nerves of your legs and feet. 2 in each knee and 2 in each ankle. And I've done 4 of those, and I have 1 more to do. And anyway, taking all of these modalities, if you will, my neuropathy is 50% better. A month or so ago, I said 30% are better, and now I'm saying 50% are better. And I hardly notice a neuropathy during the day. I sometimes notice it because I have sleep problems, and I wake up from a deep sleep and I have neuropathy symptoms that are pretty bad, but they go away, and most of the time during the day I don't notice my feet anymore. I can go out to dinner without complaining to my wife and my friends. And so I heartily support the program that's happening at this clinic. The people are also nice, putting up with my eccentric 86-year-old habits. And that's the story. It's pretty positive.
Well, thank you, John.
You're welcome.